嗨，大家好，我是老师 Alan，欢迎回到我的频道。那我觉得，邀请不同医生来频道上分享的好处就是，同样的东西，不同医生可能有不同的意见，所以我们可以从不同医生身上学习到一些不同的看法或是观点。今天是上集，今天我主要会请 Dr. Stephen 跟我们分享一下什么是近视，什么是远视，还有人到底为什么会变近视哦。那不多说，我们就直接开始今天的内容喽。This is like my first time ever recording a video in English.
Ooh.
So it's my first time.
Is it tougher for you?
No, but I mean, it's just different. Yeah, but let's see. So to get things started, Dr. Stephen, can you just kind of talk to us about what it means to be farsighted, what it means to be nearsighted, and how it can affect our vision in general?
Yeah, absolutely. So the technical term for nearsightedness is called myopia. The technical term for farsightedness is called hyperopia. Really, the big difference is for nearsightedness, you can see good for up close, hence the word nearsighted. For far away, you have trouble seeing things. As far as farsightedness, farsightedness is kind of the opposite of that, just to put it simply. Farsightedness is when you're able to see things far away. However, things are a little bit harder for you to see things up close. Now, for farsighted people, especially if they have low amounts of farsightedness, they actually don't need glasses. It's only when you have a lot of farsightedness or a little bit more farsightedness than usual where you need glasses to, say, look at your computer or also read your phone.
Got it. So near tasks will be more challenging compared to things at a distance, right?
100%.
Yeah, okay,
100%.
got it.
Sorry, I forgot the question.
Okay, let's start over.
Yeah.
Okay, so now that we understand what it means to be nearsighted versus farsighted, so Dr. Stephen, can you talk to us about why people become nearsighted in the first place? Is it all just genetics, or is it like the way we use our eyes or things like that?
Yeah, that's a great question, Alan. The way that I would tell my patients is most likely it's genetics. The way I see it is nearsightedness is due to a physical lengthening of the eyes, meaning that your eyeballs are bigger than average, and that's the reason why you have nearsightedness.
Right.
I'm 6'1", and my sister is actually she's actually 5'3". So we have a big difference in height. And a lot of people will ask me, how are you so much taller than your sister? And the one answer I have is probably genetics. There's some sort of genetics in our family that gave me the height that I have. And I think if we're talking about physical attributes of our body, say for example nearsightedness due to the lengthening or the bigger eyeball, I believe genetics has the biggest component to affecting how your eye size and shape is. So say for example, if both of your parents are really, really tall, I would imagine that their kids are going to be tall too as well. So for example, if both of your parents have very, very long, bigger eyeballs per se, I imagine their kids are going to also have bigger eyeballs too as well. Now there's always exception to the rule. We always have patients that have parents who are nearsighted, and for some reason their kids are not nearsighted at all. So I think the question or the answer to your question is still yet to be determined. But if I had to put my money on one answer, I believe the majority of it is due to genetics.
So you're saying there's different factors at play, right? So
Yeah.
it's not just like one versus the other. It's probably like a combination of everything.
Absolutely.
Yeah.
And then with the combination of everything, I still feel like there's also exceptions to the rule. One big question that I always get, it's actually parents asking me to tell their kids, can you tell my kids to stop playing video games so they won't need glasses? I think that's actually a myth. There's a lot of my kids' patients who play a ton of video games, use their iPads, and they're actually not nearsighted. However, there are also kids who don't even use the iPad, who are not playing video games, and they are actually nearsighted.
Yeah.
So I think there's still a lot of questions that needs to be answered when it comes to this question. But if we really had to point one thing, at least from my experience, I believe it's mostly due to genetics.
When baby are first born, can you kind of talk to us about what is a normal progression or the normal process of the eyes grow and develop as the kid grows up?
Yeah, So as far as kids, as soon as they're born, of course they have the ability to see right away. The first couple months they actually don't have the ability to see color. They get to the ability to see color later on, maybe in their 6, 7 months. As far as prescription-wise, it can vary. It really varies. There's kids that stay not needing glasses for a really long period of time. And then there are some kids where the shape of the eyeballs, the size of their eyeballs starts to grow. And usually when they grow, it's usually growing bigger. When we talk about kids, each month we expect them to get bigger. They weigh more, they get bigger and taller. So is the expectation for their eyes too as well. Now it's a little tricky because once they start becoming nearsighted or their eyeballs grow to a certain length, they actually continue to grow longer and longer. And that's kind of the scary trend that we're seeing nowadays with myopia or nearsightedness.
Yeah, because when you become nearsighted, the length of your eyes have permanently become longer, right? Which is why it's also irreversible.
Right.
Right? Yeah.
That was okay with the answers?
Yeah, that's good. Yeah.
Okay. I'm just straight up winging it.
You're doing so well.
I'm straight up just winging it.
I prepare so much and I can barely do this.
Well, it's also, what, this is your second language?
Yeah, but I mean, even in Chinese, it's not always easy for me either. Yeah, because I just have a tendency to kind of stutter when I talk. And then it's hard enough for me to talk to people. It's even harder for me to talk to like a camera. Where it's like, even after doing this for like a year, it is still weird for me to look into the lens and pretend there's like another person on the other side of the camera. So, yeah.
Well, I respect you, Alan, for doing this. I feel like you're providing a lot for the community, honestly. Especially the Asian community. Because they get a lot of misinformation, I feel like.
For sure, yeah.
And it's due to like, I think fear. Or what they hear on K-Asian 1300.
Yeah, a lot of times people just want to believe what they want to believe in. So they'll find like the answer they're looking for and they just believe in that. So
you're doing good things, Alan. Like seriously, this is awesome.
谢谢你愿意花时间看今天的影片。下个星期我们会继续分享到说，到底深度近视对眼睛的健康状况到底会带来哪些影响。假如说你想要知道这些问题的内容的话，那你现在可以点节目去看我下支影片。那我们下支影片再见喽，拜拜。